Hello everyone, welcome back to my channel. This is Dr. Nithya Franklin and today's video is going to be a very interesting one because many of you had requested me to talk about constipation. So now let me clear your doubts about constipation and help you identify it earlier and also some remedial measures. So as parents, we are all very concerned about the well-being of our child and want to identify anything as early as possible so that our child doesn't suffer. One such thing is the bowel movements of a child. Some children have more than one bowel movements in a day and some children have infrequent bowel movements in the sense once in 2 to 3 days. But this alone is not very significant because both of these are normal. It's about the other things the child has along with an infrequent bowel movement. So we'll have to watch whether the child is straining, crying or trying to push the stools out very hard. So if the stools are very hard and if the child is crying and trying to push it out, it is going to be a significant thing. Sometimes the stools can be very hard and the child may push and try to strain a lot, resulting in minor tears in the anal mucosa, and this can result in blood in the stool. The other thing is whether your child is having a firm belly and refusing to feed properly. All these things are very subtle signs but are very important signs too. So once we have identified that the child may have constipation, what do we do? What are the remedial measures? So the first thing is about regulating feeding. So as we all know, till 6 months, we all advise only exclusive breastfeeding, not even water from outside. But there may be situations where a mother is not able to feed for a short period of time, which may be due to her illness or due to some medications. So at those times, we may have to select a feed which has fructose oligosaccharides. So fructose oligosaccharides is normally present in breast milk, and this prevents constipation in children who are exclusively breastfed. So what does this fructose oligosaccharide do? The first thing is it's an insoluble fiber and it gets delivered in the intestine as such without digestion. In the intestine, it forms a proper environment so that the good bacteria grow very well and the bad bacteria are not allowed to grow that. Being a fiber, it starts absorbing water so that the stools become softer and easier to pass to. And there are studies which show that these fructose oligosaccharides also prevent infections in the children and improve the immunity. The third thing you can do is gentle massage. Do firm massages over the abdomen which are going to be gentle in the clockwise direction. You can also do gentle exercises for the legs like stretching or cyclical movements. So these three things, proper feeding, having a feed with fructose oligosaccharide and these gentle exercises most of the times relieves constipation in any child. So in case your child has persistent constipation or if you do have any more clarifications, please consult your pediatrician as early as possible. Hope this video is of great help to you. Thank you.